Hey everybody, welcome back to Sip and Share with me, your girl, the Sweet Physique. Today, we're going to dive right into this topic. I'm pretty sure most of you guys, if not all, have had some sort of dealing with the topic of diabetes. We all know maybe there's like a loved one that's had it. We've seen somebody on TV having to do it and maybe give themselves an insulin shot. Maybe you work in a hospital. Maybe you have diabetes. Whatever the case is, probably there's some way you've been associated with seeing diabetes and how people manage it. So there's type 1 and type 2 diabetes that people are diagnosed with. Anybody can potentially have the diagnosis of diabetes at some point in their life. And of course, with diabetes, there's some sort of issue in the body with the release of insulin or the utilization of insulin within the body that causes these problems of having high blood glucose levels in your body. And I'm just telling you right now, your body can't hang out in that level of just having high glucose levels all the time, which is why this is a diagnosis. And then we do take necessary steps to manage that or try to get rid of it / reduce it. You know, you're not always necessarily going to be prescribed insulin or oral anti-diabetic medication or insulin pump that's, put in the body. Sometimes slight tweaks to your daily activities, such as changing your diet to a more healthy one, becoming more active, things like that can sometimes be the change that is needed to get your glucose levels under control and stay that way. So like I said, we have type 1 and type 2. There's also another subset under diabetes called gestational diabetes. So with that, it strictly applies to the pregnant woman. A man can't have gestational diabetes, just saying. So with gestational diabetes, the mother's body has insulin that is being blocked from being used due to hormones that are found in the placenta that are necessary for the development of the baby. Like, it's crazy. So once again, here's the placenta causing some sort of internal issue for the mother. So the reason why this is such an issue is kind of going back to what I said. If your insulin is being blocked from being used properly in your body, that means that the glucose level in your bloodstream is not being managed appropriately. That puts you at risk for having high glucose readings consistently, which is a problem. So we kind of want to test early in the pregnancy for that, just to make sure that this is not going to be an issue for mother and baby. So hit you with a few stats. According to the NIH, about 10% or up to, shall I say, 10% of U.S. pregnancies can be inflicted with gestational diabetes. And I do want to make it clear, you do not have to already have a diagnosis of diabetes to be eligible for the diagnosis of gestational diabetes. Someone who has never had to deal with diabetes, never had this diagnosis, can get gestational diabetes. I also want to make it clear that if you do get the diagnosis of gestational diabetes, this does not mean that necessarily you will have to deal with diabetes for the rest of your life. This could be something that is literally inflicting you during your pregnancy, and that's it. So this is always a case-by-case situation, and each mother and their body is different. But about 50% of pregnant women who do develop gestational diabetes go on to develop type 2 diabetes as a part of their life. And all of these stats are according to the NIH. Just a little background for those who may not know. Insulin production occurs in our body in an organ called the pancreas. So the pancreas is responsible for producing and releasing the insulin that is necessary for our body to regulate our blood glucose levels. So for somebody like me, I have not been diagnosed with diabetes. So when I eat, ice cream, any sort of carbs, whatever I eat that ends up producing higher sugar levels in my body, I'm covered. I'm good. My body, my pancreas specifically, is going to release the necessary insulin to combat high glucose levels remaining in my body so that I am good and I can move on about my day. People that have issues with their pancreas producing insulin or releasing and your body utilizing the insulin, they don't have that auto regulation. They don't have that coverage like I do. So that's when it's necessary for them to continually check their blood sugars throughout the day, especially with meals and before bedtime. And according to the numbers, dose themselves with the appropriate amount of insulin to cover what their blood glucose readings are. Not everybody, like I said, is on insulin that needs any sort of medical correction. Some people are on oral anti-diabetic medication as well. Like I said, this is just something that is a case-by-case situation, and this is something that your doctor comes up with for you as the best plan to kind of help combat high glucose levels in your body. All right, guys, so the best way to manage this diagnosis is just to first off know you have it. So early screening and detection is key to being able to hop onto a positive diagnosis of this as quickly as possible and get the ball rolling with coming up with a personalized treatment plan for you. With that being said, there are a lot of key components that can be added into your treatment plan to help you combat this diagnosis and have the most successful outcome postpartum. First thing I'm going to talk about is your diet. I kind of mentioned this earlier, but your diet can be key in combating this and making sure that your levels are staying in an appropriate range. So obviously your physician is going to work with you to making sure that you're eating the correct things. Sometimes we can come up with a diet plan for you, just kind of outline things that you need to make sure that you're getting in your diet, avoiding too much of, just so we can make sure that your glucose levels are staying in range as much as possible. My next point is your activity level. I can't stress enough how a sedentary lifestyle is really just not good for anything. The more active you are, the better you feel, the better results you can get from being in shape with your body. And even with your pregnancy, being active is just key to having better results in your postpartum outcome. Now, I know that that is not for everyone. Some others have been told you have to be on bed rest. There's different things going on. But in general, being active and having a high activity level within parameters that are good for you is going to be good for you and your baby in the long run. I highly recommend for any pregnant mother, well, people just in general, but pregnant moms in this situation that need to get more active, if you can, get a Fitbit, get an Apple Watch. Those are things that help you stay on track. If you're a visual person, you see the stats, it's motivational. It's great to get the message like, hey, you've gotten in a mile, or hey, you've gotten in 600 steps today. Like, it's great to see that. And then if you're able to build on it and reach more levels of progress, you're just going to feel great about yourself. So I highly recommend getting one of those products to track your progress and just kind of see maybe where you started to where you ended. Another thing that's key to this is following your doctor's plan for you when it comes to checking your blood sugars and how often they want you to do it. If they say breakfast, lunch, dinner, and bedtime, please do that. Do not skip anything. Those numbers are important. We want you to be able to treat your blood sugar when you need to treat it, but you can't treat something if you don't know what it is. And when you eat meals, that is like the common time for, your blood sugars to be higher, and you want to make sure that you are just getting the appropriate amount of insulin in the body. Another thing too is if you're just feeling off, there's so many signs and symptoms to having high blood sugar and low blood sugar. If you're feeling confused, like fuzzy memory, blurry vision, sweaty, clammy, headache, dizziness, just anything that makes you feel off and you're like, this is weird, just check your blood sugar. It's not going to hurt you in the long run. I know it's an extra poke and we don't like getting poked, but in the long run, it could really save you from a catastrophic event, and it's knowledge is power. So now you know, okay, this is probably because my blood sugar was 32, or this is probably because my blood sugar was 300. Or if your blood sugar is normal, then we're like, hey, there's another problem at hand, something bigger, and maybe I need to go get evaluated. So checking the blood sugar can definitely shed a lot of light on which direction you need to move in based off of what's happening at the moment. Also, you need to be comfortable with potentially having to administer insulin injections. If that's part of your treatment plan, of course you're going to get training and education on how to do it, but you have to also be comfortable. Some people just are not comfortable giving themselves injections. It's okay. You're not alone. I don't like the thought of that either. So in that case, it's important to have a friend, a loved one, somebody that can do that for you, and that they're a reliable source to do it when you need them to do it. So proper training for them, having them along with you at these doctor visits so they can get the proper education, all of that is great, necessary, and important. So pre-planning to know who your support system is going to be if you are not able to do it for yourself is key. I just really want everybody to know, if this is a diagnosis that you are going to have to maintain and deal with during your pregnancy, you are not alone. So many mothers are inflicted with this and having to make adjustments in their lifestyle to account for the situation, monitor it, and make sure that they are good and that their baby is good. So don't ever feel like this is something that's personal, like I'm the only one going through this. No, you're not. You are one of lots of mothers that unfortunately may have to add this on your plate in addition to kind of already rolling with things that are going on just by being pregnant. And I know it's a lot, but there are definitely people here for you, and you are not going through this by yourself. But I always want you to remember, if you have any questions, please, please, please reach out to your physician and get clarity. Don't do anything based off, I think that's what I'm supposed to do, but I don't remember. You want to do everything according to how you're supposed to do it, because we don't want to make mistakes. Your life is precious. Your baby's life is precious. So clarity is key to moving forward with any uncertainty that you may have about anything in your treatment plan, or just anything that may arise that you just want answers for. So let's talk about the negative ramifications that can happen to you and your body if you do not properly manage your blood glucose levels. One of the things that can happen if your gestational diabetes or your blood glucose levels during pregnancy is not managed properly, you can have put yourself at an increased risk for developing high blood pressure, which we already know based off my prior videos can lead to preeclampsia and or eclampsia. Not managing your levels also puts you at a greater or an increased risk for having to have a C-section. And it also puts you at an increased risk for developing diabetes postpartum. So there's also negative outcomes that not only affect the mother's pregnancy, but can also affect the baby. Not controlling your diabetes levels during gestational diabetes can put your baby at an increased risk for growing too fast and being too large, which cuts you out of having a vaginal delivery, and now your doctor can only do a C-section. It increases the risk that your baby will have respiratory distress syndrome. So your baby will have issues with their breathing. They may not be able to breathe on their own. Their breathing pattern may be affected. So it can negatively affect them with their lungs and their respirations and all of that. It puts your child at an increased risk for obesity in childhood and also for developing type 2 diabetes in their life. So not only is there risk factors for you as the mother, there's risk factors for the baby as well. Then in general, long-term effects that not having properly managed diabetes and how it can affect your body. It can affect your eyesight. You can have blurred vision, diminished vision, visual changes, just so many things that can happen to your eyesight by poorly managed glucose levels. Your heart and your blood vessels can be affected. Having high glucose levels eventually affect like the durability or how efficient your blood vessels work in your body, and it can lead to other problems such as heart disease, stroke. So this can also affect the vessels in your brain. This can affect your kidneys. High glucose levels that are in your body consistently like this affects the functionality of your kidneys, which could, if this goes on long enough, can lead to kidney damage, and then down the road can lead to you needing dialysis. It can affect your skin. There are a lot of people, I've seen so many patients that come in with sores on their skin, call them like diabetic ulcers, especially on their feet. There's just so many things that can happen to your skin integrity as well. It also affects your nerves. A lot of people have nerve damage with diabetes because they feel like tingling sensation or numbness in their extremities, like their legs, their feet. And that's also why that leads to skin issues in their feet, because if you have numbness in your feet, you can't feel a cut. You can't feel, your shoe rubbing up against your foot leading to a blister. You don't know you have it. Then your blister goes on to get infected. Then it leads to an ulcer. Then you have this infection. Like, there's just so many things that go on because you can't feel, because now you develop neuropathy. I can't stress it enough that you need to just know your levels, manage them, and do what you need to do, because it's not just one thing. This diagnosis of gestational diabetes, or if you go on to eventually have just type 2 diabetes from this, it can affect you in so many other ways than just having to check your sugars for the rest of your life. So knowing your numbers, managing them, and staying on top of everything is critical. So definitely the key takeaway points from today's discussion is, if you're pregnant, make sure you have early detection and screening so that you do know your status with gestational diabetes. And if you are positive, do not panic. Your life isn't over. Your baby's life isn't over. Just speak with your healthcare provider. Come up with a tailored, customized plan for you and your baby, and do your very best to follow that to the T. Ask questions if you have any. Like I said, knowledge is power. Stay on top of your numbers, get active, have a healthy diet, and make sure that your village is there for you in case you need that pick-me-up. Maybe you can't give yourself injections if that's part of your plan, or if you just need an accountability partner. This is new. This may be new for you. And so sometimes you just need somebody to check in. Hey, did you do this? Your daily reminder. So just making sure that your village is there to support you. They're there to just make sure that you're good and just help you stay on top of managing this diagnosis, because we already know as a pregnant woman, you already have enough on your plate. You don't need this. But this is your life. You have been afflicted with this. So let's do what we can to manage it in the most graceful way as possible. I hope you guys found this very interesting, informational, helpful, all of those things. More content dropping soon. See y'all later.